the $475 million investment that was recently announced by you just 3 days back. Can you shed light on what exactly is being done with this investment?
Yeah. There's nothing more important than our children. And now more than ever, we need to focus on ensuring that people have the right supports at the right time. So on Tuesday, we did announce a $475 million investment. That's new money in addition to the money that we are already spending that will be available to families who have children with disabilities. This new funding is being delivered in 3 ways. First is expansion of our community-based services. So $80 million going to community to provide additional support like therapies, speech and language therapy, occupational therapy, expanded behavioral support, expanded mental health support for neurodivergent youth, and navigation services. That expansion is available to all families and children experiencing different types of needs across our province. The 2 other things that we have announced are 2 new funding streams. The first is a child and youth with disability benefit. This is a new benefit for families who have children with the most complex high needs of either $6,500 per year or $17,000 per year. This is a massive expansion to more children. Thousands more children will receive supports through this new model, including children who have Down syndrome or autism and an intellectual disability, complex medical needs. The second funding stream is a child and youth with disability supplement. This is an income-tested supplement and delivered with the disability tax credit available to middle and low income families of up to $6,000 per year to use on things that help them parent a child with a disability.
The plan that was already existing, what's different with the new plan as compared to the plan that was existing before?
So we undertook 2 years of extensive consultation and engagement with families, with service providers, with experts. And what they told us was that our current system wasn't working for so many children, that there were many children who did not receive any direct funding whatsoever, children with Down syndrome or fetal alcohol spectrum disorder or other complex intellectual disabilities didn't receive any financial benefit. And that was really seen to be as unfair. The other thing that families told us was that the level of support did not always match the level of need. So autism funding, there's a saying, if you meet one child with autism, you meet one child with autism. They're not the same. You could have a child with autism with really complex high needs and a child with autism that has more moderate needs, and they received the same. And families told us over and over again that needed to change. And then the system was very complicated to navigate, and they needed it to be simpler. And so we've responded to that, and we've made those adjustments so that we provide more direct funding to more children based on need and make it easier to navigate and provide more investments.
The investment that was already done in the previous plan, is that being brought into this new investment, or that stays in this $475 million, comes as an addition to the existing investments?
Yeah, this is all additional funding. So the money that we had in our budget before for children and youth with disabilities stays the same. And in addition to that, over the next 3 years, there's an additional $475 million. I'm a mom of a child with autism and an aunt of a child with very complex needs. This type of investment for children has not been made. It's historic. This really is transformational and will make a meaningful difference in the lives of children and their families that are having quite a lot of pressure right now. And so I think it's a really important way that we move forward and an investment in tailored and targeted approaches to supporting children and youth with disabilities.
What we've heard from the community or some members from the community, the autism-related detection, that only happens at Sunnyside Hospital. And the wait time there is long. And some of the community members said that the wait time can go as long as 3 years. What is being done to reduce that wait time or to create more services, more options for the people?
Mm-hmm. Yeah, it's really challenging when you are waiting for an assessment for your child. So there's a couple of things. First and foremost, these changes will help that. You don't need a diagnosis to access the expanded community-based services that we are delivering. So if a child is waiting for an assessment, they will still be eligible to receive services. Secondly, we're doing a lot of work with Sunny Hill and community providers to expand the way that we do assessments. And so BC Centre for Ability, for example, is partnering to use community-based pediatricians and psychologists and speech-language pathologists to increase our assessment capacity. And so we're working very closely with health and other ministries to support that. A lot of work to still be done, but we'll continue to work on that.
How is the new services, new plans going to be communicated to the people in need? That's probably going to be one very key part of this whole process, because people knew about the existing process. Now, when the new process comes in, how do people access all those services? What is the government doing to communicate what the new process is?
Yeah, that's a really good question. Change is challenging, and it's expected that there will be anxiety around this. Parents just want the best for their children, right? And so this is a phased approach over 3 years. We will be working alongside families to make sure that they don't have to navigate it alone. So we have a website that we've launched, a 1-800 number that families, or 188, the number I can provide to you that families can call to speak with staff about the changes. We're doing a number of online engagement sessions so families can come on and talk to ministry staff. We'll be working with community providers and experts in the province along the way to make sure that families have what they need. The changes are not happening tomorrow. They're going to happen over the next year and the next 2 years and the next 3 years. And so we'll really partner with families to ensure they have the information they need.
Stigma related to the special needs children, it still exists. We have multiple examples regarding that. What is the government doing to make sure that that stigma can go down or it can be eliminated?
I think that comes from fear, and it comes from, every parent or family member wants their child to live their best lives. And when there's a challenge associated with a child, there's all kinds of feelings that come from that. We are trying to build an inclusive education system where all children play and develop friendships together of all different types of abilities, community-based programming that are inclusive so that children who do have challenges can go to their local rec center and swimming lessons and skating lessons just like everyone else. I think it's really important for families to know that early intervention and support helps change the trajectory of children's lives sometimes, all the time, right? That access to things like speech language therapy, occupational therapy, that supports children to better interact in our communities and be included in really good ways. And so we'll continue to communicate that out. We'll continue, having opportunities like this to come to connect and talk to your audience is really important. And so we'll continue to do those things at every opportunity and engage with different communities and have, culturally appropriate information and supports and things like that. And always, like I said, more work to do, but we're committed to doing that work because there's nothing more important in our province than our children and our youth and our young people, and we need to make sure we're supporting them.
Minister Wickens, any other comment?
Well, thank you for the opportunity. We'll provide you with all of the information about the website, the phone number, and I'm happy to come and discuss more or have engagements with your viewers and your listeners. And I'm just really grateful for the opportunity.
Thank you very much.
Thank you. Thank you.